social and behavioral change communication, and community participation for vector-borne disease control. So here, of course, there will be two things we'll be covering. Number one is the social behavioral change communication, what is known as SBCC, for vector-borne disease control, and community participation for vector-borne disease control. So social behavioral change communication was earlier known as behavioral change communication. Now the social aspect has been added to it, because earlier it's more related to the individual, but subsequently it's more to the society, to the community. So now the definition of this social and behavior change communication is that this is an attempt to change the population's behavior, not individuals' behavior. It's a population's behavior by influencing its knowledge, the knowledge of the community, knowledge of the people, not individual, but it is the population as a whole. Then what are the attitudes and social norms via a singular or variety of communication techniques, because we have to improve their knowledge, we have to change their attitudes, we have to put them into practice. So for that, what the communications that we have to do that, and this particular strategy is a component of the vector-borne disease control, and that is given more emphasis on it, because particularly that to ensure community participation for the control of vector-borne diseases. For case detection and treatment, it means they have to seek the behavior for accepting vector control measures, and also doing certain activities by the community itself. So we need to have some kind of awareness creation. That alone is not sufficient. We have to change their attitude, we have to put them in practice. So this uses mainly in a communication approach to the people to promote change in their knowledge, attitude, norms, beliefs, and behavior towards control of vector-borne diseases. And it refers to the coordination of the messages and activities across variety of channels. This is, for example, to reach the different levels of the society, including the individual, the community, the services, and the policy. So it is more of a theory, but it is evidence-based. It means that depending on the community perception, the community knowledge, then we have to devise these communication strategies. So it is designed based on the existing data, particularly on the community and the individuals, and they follow a systematic process by which analyzing the problem in order to define the barriers, because why the people are not participating, why the people are not willing to accept a particular intervention, and that is barriers have to be identified. So based on the existing information, and it is a systematic process of analyzing it, and also the motivators to change. What are the different factors that can be used to motivate the community, and design a comprehensive set of tailored intervention in the sense tailored to a particular situation that promote the desired behaviors. So this strategy is the document that guides the design of interventions. It means the strategy finally ends up with the kind of a design of interventions, and establishing the intended audience, because we have to identify who are the audience, and setting behavioral communication objectives, and determining the consistent messages, materials, and the activities across the channel. So this is the content of the social behavioral change communication. As I mentioned, that it is beyond behavioral change communication, which is targeting only the individuals, but it is extended or expanded considering the socio-economic context that grounds the individual behavior and the performance, the preference for using SBSs against the pieces. As I mentioned, it's more of the community, not the individual. Of course, community means the population, means the members also. So here, if you see that it starts with the individual, and individual means we need to know what is the knowledge of a particular subject, then what are the skills they have, what are the benefits and values they realize, and self-efficiency, then perceived norms, and then perceived risk, and then emotions. These are some of the factors which really influences on the behavior of the individual. So we need to know that. So once it's done, of course, the next level is the family, and the network, the peer networks. It means what is the influence, what is the spousal communications, and then partner and family influences, and then social support, etc. Then family, it means group of families and become the community. Then community means you have a leadership, leaders, and then access to information as a whole, the community, and social capital, and also the collective efficiency in that particular level. Then, of course, we also have social and structural component. It means that the leadership, the resources and services, and policies and regulations, and the guidance and the protocols. So, of course, if even the people intend to do it, so there may be certain barriers, certain limitations, like you should have some regulations, you would have some policies, you need to have some kind of resources in terms of man and manpower, and we need to have clear protocols, how to do that, how to go about like. So also we have the structural component. It means the religious and cultural values of the particular community, then gender norms, and then media and technology, and then income equity. So these all the informations which we require at different levels, from the individual, then family, then community, and also the organizational functional structure of the community. So then what is the, as I mentioned, the definition, and it uses the strategies, communication strategies that are based on behavior science to positively influence the knowledge, attitude, and the social norms among individual institutions and communities. Then it is a kind of a learning process that particularly makes the community, empowers to make informed decisions, because they can make certain decisions on even the health aspects with the support of the health system. And also they'll develop their own skill and then modify the behavior for a better, the impact on the health, and change in mindsets. That's very important. Then, of course, act accordingly. So this is not a one-time activity. So it is a continuous activity. So sustainability is very important. Then, of course, earlier it was IEC, information, education, and communication. This is mainly just to create awareness. It means tell the people what the program is doing. That's it, not more than that. And it is viewed as a kind of a supportive service to the strategies for the control of vector-borne disease. For example, it's like the case detection and treatment, or the vector control. So that all the services, they are the services that which are being used for the control. But this particular IEC was a component to support the service of that. But when it comes to social behavioral change communication, it is an integrated process that links, first of all, advocacy. It's very important at different levels. We need to have advocacy, make the people to understand the importance of controlling vector-borne diseases, and community participation. And social mobilization is very important, because we have to mobilize the community for support. And then communication, of course, this can be achieved through communication. And by doing that, so there will be increase in the knowledge, beliefs, values, attitudes, and confidence, and suitable practices at different levels. Then removing barriers that restricts people to get involved. That's very, very important. What are the barriers? Whether sociological barrier or economical barrier or policy can also be sometimes a barrier. Then development of enabling environments and the service delivery. So these all the important links that SBCC has. And then the objectives, if we say that, of course, it has to be carried out on a campaign mode. And that's mainly the main purpose, enhance awareness on a particular disease and the methods of prevention, and also the importance of the community participation. Then promote the attitudinal and value changes in the among the target audience. Then build support for the program, not only the community, but also across intersectoral partner organizations like healthcare providers and also the other supporting organizations. Then stimulate increased and sustained demand from the community, because that is the one which really promotes the quality prevention and care services. That's important. That should be kind of creation of the demand among the community. Then ensure availability of the resources. If there is a demand, it means there should be some kind of matching delivery of the services. Whether do we have that kind of services like? So we have to make sure. Then improve quality of life and social and economic conditions. This is very important. When there is an improvement in the social economic conditions and the quality of life, definitely the risk factors will be reduced. Then initiation of behavior change at the individual and the society level through strategic communication for information and decision making, and appropriate action towards reducing morbidity on account of vector-borne diseases as a whole by half, and efficient morbidity control and elimination of Kalasar, because we have the target of elimination of Kalasar by 2021 and lymphatic filariasis of 2021 again. Of course, now it is getting realigned with the global target of NTDs, neglected tropical diseases, by 2030. So it means our national program emphasizes more on the importance of the behavioral change communication. So the principles is that we have to identify the target audience. Is it everyone in the community, or men folk or women folk or working groups, something like that? So we have to identify what is the target audience, and then we need to have some kind of confidence building among the audience. How it is like, because now the actions that are aimed at is case detection and treatment, and drug compliance. That's very important, particularly when you give mass drug administrations. Then ensure reducing the mosquito breeding places, because most of the breeding habits, particularly for the dengue vector, it is a man-made problem. So, and agriculture department, that of course creation of the vector-borne diseases, they should know that these are the breeding places, and these breeding places are influenced by the human activities. Then of course adopting the personal protection measures. And for example, lymphatic filariasis, those who are already diseased, and we have some kind of morbidity management strategy or package by which daily food care for the lymphatic filariasis cases. Then willingness to cooperate during the night blood surveys for microfilaria survey, and then insecticide, residual spraying, etc. So this, in the sense that we need to build a kind of an confidence on these activities and the importance of these activities among the community. Then it is always evidence based, as I mentioned, that we need to understand the demographic features, and thereby we have to make your own strategy. Then identification and neutralization of behavioral barriers. There are a number of barriers in the community, so that that barriers will prevent or limit the participation of the people. So we need to address, have the messages, have the communication to overcome those barriers. Then continual checking is an integral part of the SPS, because when you have a program, any strategy for that matter, so we need to have some kind of component of evaluation, that monitoring and evaluation. And then finally, we need to match our services to that particular demand. That's very important. So these are the principles of having the SBCC campaign. So these are the steps involved in the behavioral change of the individual. For example, knowledge is very important. So maybe I know about the risk of this particular disease. I know about the preventive activities, vector control, things like. So they may know, or they should know the information. So the knowledge, either they have the knowledge, or we have to create that knowledge among the people. Then once you have the knowledge, then there should be desire. It means that the people should be interested to do it. For example, they accept the drug, accept the intraresidual spraying, accept the nets, etc. So it means I want to do that particular thing like. Then of course the skill. So for example, certain activities are intended for the community, so they should have the skill to do that, how to do that things like. Then optimism is important. So once you have the knowledge, when they have the desire, do certain activities, and they should have that the knowledge, and also that they have the desire that it's worthwhile to do that. So there should be some kind of optimism in their activities. Then of course facilitation, it means that there should be some easy way of doing it. That's very important. Very hard activities, for example, certain activities which require time and then money, such things may not be useful. So there are certain facilitating factors to make it the activity simple and easy. So it means doable by the community. Then stimulation, it's very important. because when an individual is doing it, the other individual will also join. So it means I am joining the group, I am joining the others in conducting this particular activity. That is a kind of an stimulation, stimulating others who are simple, the spectators. Then of course reinforcement is important because it doesn't stop there, so we have to continue this activity until you succeed in this particular vision. So this is a kind of change, starting from the knowledge and putting into the people, action into people into action, and finally to sustain that. So this is a kind of change in communication behavior. So this is an elaborate, the different aspects. The first, the central point, blue one, is that it is a behavior change communication. So it means that we need to behavior change communication. It means it leads to planning, decision making, and implementation of certain activities by the community itself. And there should be some kind of to facilitate, to create a kind of an environment. Then we need to have some kind of advocacy for developing these strategies, that is PCG strategies. It means that enabling environment has to be created. And of course, this can be done by the second level is through social mobilization. Through social mobilization, and also other sectors can also be involved. And then finally, the other factors it means by which you can do it is that, of course, it starts with the program communication. It means that we have to communicate the people about the program, and of course we have different channels, mass media campaigns like TV, radio, etc. Then organized networks, unions, and cooperation, because it is a different the organizations in the community itself. Then how to have a kind of network with those people, like, and then families, communities, and then care providers. There should be some kind of integration, and also civil society groups and local self governments also a partner, and then community dialogue and participation, because we need to have a kind of initiate community dialogue so that they will understand and make them to participate. And the evaluation should be an, as I mentioned, in inbuilt component. That is a kind of feedback to that if necessary. Once you plan, implement it, and of course you may require some replanning, and that's you need a kind of a feedback, and monitoring will give you the feedback. For example, now the baseline situation analysis for control of vector-borne diseases. In India, of course, we align all our activities with the WHO's global and regional targets and strategies. For example, elimination of malaria by 2030, like. Then in that, of course, we do have early diagnosis and complete treatment, integrated vector management. Of course, we have different means, endorestial spraying, use of bed nets and things like. Then advocacy is an important aspect, advocacy at different levels, but also an important component which has been included here is communication for behavioral impact. It is known as COMBI, which has been tried for the dengue vector control, and the intersectoral convergence, because it is a disease or which is communicable diseases, and other sectors is also involved. So we have to have some kind of convergence of the other sectors. Then surveillance, supervision, monitoring, and evaluation of the program is important. Capacity building and program management is another important aspect in the control of disease. So the baseline situation analysis in NBBDC, if you see that high to satisfactory level of awareness about malaria, its signs and symptoms, mode of spread of the disease by the mosquitoes, and the stagnant water as source of breeding. This information, in fact, has to reach the people. It means creating awareness on this. However, in spite of all this, whatever earlier we have IEC and BCC, still there is a gap in the knowledge, and there are certain barriers to overcome so that we can make sure that there is a participation of the people in the program. Then coming to diagnosis and treatment, many people, they are ignorant and they are all different about in their views about the importance of early diagnosis and complete treatment, and then harm of the delayed treatment seeking. That's very important. When you delay the diagnosis, what will happen, like, and then signs and symptoms of other vector-borne diseases, and the benefits of complete treatment for malaria, mass drug administration for filariasis and other vector-borne diseases, and home-based management of lymphedema. So similarly, lack of knowledge about availability of free diagnostics and treatment services at various levels, because they know, for example, even if COVID, if you take that, many people are not aware it's given at free of cost. Like, so it means that there should be some kind of proper communication to reach the people so that they can make utilize or use of the available free diagnostics and treatment. Of course, another important, the facility should be available at the different healthcare facilities. Then the healthcare providers will also require some kind of advocacy, sensitization on all these things. So this is very important for the community to participate in that. Then coming to vector management, see, the community mostly they are ignorant about the diverse man-made breeding habitats. For example, now most of the habitats are being created by the community, so that they should know that they are responsible for the creation, and that leads to the transmission of the diseases. And then locally suitable vector and environment management, the management, and then full coverage of the house by indoor residual sprays. And the newer, for example, if they come and the sprayman goes and then say, okay, spray only one room and go, like, so that is not going to be a kind of total protection from the mosquito bite. So they have to make them to realize that complete treatment of areas is important under residual spray. It means a full coverage. And the newer technology like larvivorous fish use, insect-treated bed nets, and timely reimpregnation, all this information they need to know that. So using the nets, of course, is a physical barrier. They must know that. And if insecticide treatment is done, so it has additional protection. It's a chemical barrier to kill and as well as repel mosquitoes. So those information should reach the people so that their acceptance, compliance will be more. Lack of responsibility towards preventive measures of individual and collective levels. Then, of course, the limited efforts to integrate the prevention control activities, because when you have the outbreak, so you'll have activities, but preventive measures are very, very less. In fact, emphasis is not much given. Then these are some of the issues. Like, for example, when you make messages, they are too broad spectrum based. Then indistinct and not reinforcing, because it's not one time telling is not going to help. So repeat the visits and reinforcing is very important. More text heavily than illustrative, because too many text messages, people will not be interested to read, so that the visual illustrations will be very good. So too many messages diluting the attention span and the recall, and then message is often deficient as per the local needs, because what is the message, it has to suit to that particular community. Then monitoring and supervision is inadequate as far as this particular implementation these particular strategies. So almost no process and outcome assessment is there, because once any program, so we need to have monitoring and evaluation, and also that assessment will help us have a kind of feedback to improve the performance. Then, of course, in the process of behavioral change, if the people are unaware, and there is a need to make them aware of this. So it means unaware people should be made aware of the situation. And once they know that the problem and things, like once it is recognized by the people, then people start to acquire the knowledge and skills. It's important. It means knowledge in terms that where the mosquitoes are breeding, and then what are the measures they can do that, and things like. So the skills and knowledge which they have to acquire. And also once they have acquired, then of course they also need some kind of motivation. It means something pushing them enough to certain action. So you make it some kind of the compulsion to make the people to participate in that. Those the next stage is, of course, trial. So when you do it, so you'll start realizing the benefit of the program. Like, so that is during the trial period. So you'll be able to demonstrate that the new change in behavior has resulted in this kind of benefit. Like, and then end point is the success. The success doesn't stop with achieving one point of time, but it has to be sustained. This is very important. So this is the process in the change in the behavior. So this is a kind of the flow chart linking the different the parameters at different categories. Finally, what we need to know that is a societal impact. That to achieve the societal impact, so we need to have a collective action. So when you have a collective action, there will be some kind of conflicts or dissatisfaction. So how to address that? So we need to have a community dialogue. So it means we have to talk to the people with this, the situation and things like. And there are certain the catalyst which really facilitates this kind of dialogues. So here, catalyst or nothing but to start to trigger that initiates a dialogue about a specific issue is the potential catalyst or the internal stimuli. It's in the onset of an epidemic. For example, now COVID is one of the examples where there has been it created a kind of an internal stimulus so that the people they take most of the preventive cares. And then change agents is either NGO or the program themselves. They can give certain information so that there is it can be a catalyst to motivate the people. Then innovation and availability of new technology. For example, now the new drug, new vaccine, new diagnostics are available. That has to be made. That information should be available to the people. Then policies is very important, and the government has to enact certain policies. So create a kind of environment where the community can take up their own activities. And then mass media campaigns is very important. Now we know that we have a different channels, so we have to maximize those channels. Then coming to the community dialogue, this is very important. We have to talk to the people. What is the concept? It means any social change should be sustainable. If the affected people or the communities want the process and then content communication, because this has been tried, the affected people, like for example, in the Kailash area and in the lymphatic filariasis, all the deceased people, they are the good motivators that they can make any change. So we can start with the community dialogue through them. Then such community dialogue would sequentially lead to a collective action. So thus a shared problem can be solved. This is the concept. And then steps in the community dialogue is recognition of a problem. That's very important. The community has to recognize, identify, identification, involvement of the leaders and stakeholders, and then clarification of the perceptions of what the people have. What is the perception of the people in the community on the disease? And we need to clarify that. Expression of individual and shared needs, and then vision of the future, assessment of current status, setting objectives, options for action, then consensus on action, and finally action plan we have to prepare for the prevention of the disease. Then of course the conflict or dissatisfaction. This is a group of people that have, some people will have always the negative attitude. So we have to identify them. And then action plan for conflict management, it should be through collaborating, so involve them. And the competing, it means that compete with the science, with the knowledge. Then avoiding, then accommodating and compromising. So which is suitable for to tackle that particular conflict or dissatisfaction. That's very important. So we need to consider this. It's very important negative factors to how to eliminate, to handle or manage the conflicts. Like there are options for action and setting objectives, even to manage this this group. Then of course assessment whether we are able to bring back to the confidence of the program. Then collective action is very important. As I mentioned that the social behavioral change communication targets the community as a whole, so that collective action is very important. This is when a group works on that, so there should be some kind of someone has to hold the responsibility. So we need to assign a person on the responsibilities of certain activities, mobilization of organizations, and then implementation. And also we have to identify what are the outcomes. And then of course we need to have some kind of evaluation. So we have certain activities and what is the outcome, whether we are able to achieve whatever we desired. And that should be a kind of a participatory evaluation. It means everybody together we have to assess the situation so that we know that what are the weaknesses and the strengths and the program. So then finally we'll be looking at the end result. End result is a societal change or impact. It's, as I mentioned, it is the social change, not individual. Of course, it comes through the individual. Then elimination of, for example here, elimination of the stagnant water in and around one's own home, because we know for the dengue vector control, this is the method which we have to do that. It means source reduction. Then start a community dialogue, and also you prepare a kind of action plan, joint action at the society level, so that everybody will support it. Then advocacy is very important. This is it gives a kind of an enabling environment. So when you say enabling environment, the advocacy not only with the community but also with the other sectors, that's very, very, very important, starting from the political leaders and the local bodies and the other sectors, right? And then of course building support and the eliciting the commitment and motivating them, that is other sectors, very, very important advocates of a particular social development objective. So advocacy particularly aims at developing, enabling environment, as I mentioned. Of course, we have different partners in that for different activities. Then eliciting the commitment is very important, because the commitment is not from individual or from the society but other sectors also. So for that, we need to have advocacy. Then motivating them to be advocates. Those they themselves can be the advocates to other group for particular social development objectives, and particularly in this case, prevention and control of vector-borne diseases. Then, of course, the advocacy can be at different levels, and the advocacy can have, we can have advocacy workshops, and we can have some standard agenda. So the initiatives at the block level, so it means that the head of the, that local body can be the chair for that workshop, and we can have the convener. So we need to have a technical person, so medical officer can be the convener, and the participants, of course, community plus all the sectors in that particular area. Then the workshop should cover, we have to tell about the vector-borne diseases, and then their prevalence, and then the burden, etc., and then development and the urbanization and the effect on vector disease borne diseases, because other sectors are involved. They also contribute for the creation of the mosquitogenic condition. So we need to have the other the sectors, and we have to tell them that, like for example, urbanization, how urbanization has resulted in creating mosquitogenic conditions. So that component should be there. And then roles and responsibilities of stakeholders, because we have different stakeholders. We have local bodies, so we have NGOs, and the NGOs definitely they can contribute in terms of the manpower and things like. So we have to identify what are the roles and responsibilities of the stakeholders or the partners. Then action plan with a specific time frame, that is very important, because it's not like have a workshop and explain to them, like, but at the same time ultimately we need to have some kind of plan, and the plan should have some kind of timeline, like milestone and things like. Then integration of NVBDCP with ongoing activity, that's very important, because it is not in isolation. So it had to go with the program. Then live demonstration of the mosquito larvae and larvivorous fish. They should know, for example, when you talk about the fish eats the mosquito larvae, and they must know that this particular fish is useful for controlling the mosquitoes like. Then insecticide treatment, bed nets, treated bed nets, and then the community also needs certain, the insect treated bed nets, not like LLINs, so require some kind of retreatment. So they must know that the retreatment is required. Then display of species materials, and then distribution of the kits to the participants. Then of course the kits you can have like flashcards or the flip books on the early case detection and treatment, what's the test it is being used, what's the treatment and things like, and the importance of complete treatment, and then complaints under mass drug administration wherever you have the mass programs, and then use of larvivorous fishes, and then bed nets, insecticide treated bed nets, and then the covering of the houses with the with the the mesh and things like, and then spray coverage, full house coverage, then home-based management of lymphedema, and then measures of source reduction, and then booklets. Of course, we can prepare that. The NVBDCP has already developed the public-private partnership for the control of malaria, and that can be a kind of a source material for the social behavioral change communication. Then, of course, all these communications end up with kind of social participation. And so to achieve social participation, so we need to have social mobilization. So we have to mobilize the society, the individuals and the community to participate in the program. So it means that the community has to be increased or enhanced with the capacity to voluntarily utilize the services offered. That's important, because they must know that these are the services available, and these services should be utilized by the community. Social mobilization is the process of bringing together at least to raise awareness first, and demand for a particular program, to assist in the delivery of resources, etc., to strengthen community participation. It is a dynamic process, a responsive process. It means that it's not one way, it is a responsive. It means that kind of getting feedback whereby people are organized and in order to enable them to collectively think and act. Social mobilization is the essential pillar of health promotion. This is, of course, we know the beneficiaries or the community. So it is a powerful tool to address inequities through community engagement and the grassroots-led actions. So it ensures that priority health and social concerns are those expressed by the community and not determined by top down. So it should be like bottom up, like. So this actually through community mobilization we can achieve. So when I just look at the social mobilization, the elements, concepts, and the principles, the elements are so when you want to really mobilize the the society, so we need to start with the political mobilization, government mobilization, the community, and then the corporate mobilization and beneficiary mobilization. So these are the elements in the social mobilization, not the individual or the families, but the whole the community in that particular area. Then concepts and principles, it's, as I mentioned, that community participation is finally is a kind of empowerment on to handle that particular situation. Sustainability is very important because the diseases is going to occur, new diseases are coming up, so that this system has to continue. So sustainability is very important. Then cultural sensitivity and the gender fairness is important, equity, and then integration. These are some of the principles and concepts. And then, of course, when you do a policy advocacy, and then, of course, we can have social marketing. In the sense, social marketing is nothing but the demonstration of the usefulness of a particular strategy. Then once people understand, the benefit of that, then they start using it. Then that can be achieved through behavior change, communication, and finally that results with the social mobilization. And in this particular process, social mobilization, intersectoral convergence is important because it is not like a health system alone having dialogue with the community. So other the sector should also take part, in the sense that we need, we know that there is a need for a program, but the demand should be should come from the people, the community. So we need to create some kind of felt need from the society of a particular control of a particular disease. So alternatively, if the community is unable to recognize a disease as a threat, social mobilization strategy is directed to create a demand for the services and to convince the people to have it. So the intersectoral convergence is also very important. So the communication initiatives, the different approaches, identifying, engaging the top journalists and covering the social sector, and steady flow of information through different media, sustaining the positive message in front of the key audience, then countering negative stories. That's very important. Then publicizing achievements, etc. Then promoting media responsibility, focusing communication on the on key issues, ensuring continuity. Then particularly that which is critical for ensuring continuity. Then targeting women and children as a critical audience because they are more at risk for certain diseases. Then assigning higher weights before and during the high transmission season, because now the reinforcement has to be there during the transmission season. Then messages incorporated into the popular soaps and cereals, etc. So these are some of the approaches one we can think. And the 7 C's for effective communication initiatives are the command attention. That is very important. So this we need to get the attention of the people. Then create trust. When you do that, as you kind of ensure that the people have a trust on it. Then clarify the messages if they have any doubt. If there is any kind of confusion, then we have to clarify that. Then communicate the benefits. This is very important. When they do this activities, what is the benefit the individual and the community are getting? Then cater for both the head and heart. It means the knowledge and as well as the kind of attitude. Then call for action and also consistency is very important. Then of course there are two aspects. Number one is the achieving the behavioral change. So as I mentioned, that combi is one of the approaches which is being used to involve the community. So here it is what we call it as HICDOM, and the first three HIC are a part of IEC. So it's more on the IEC programs focus more on HIC. It means hear, inform, and convince. It means hear about the new behavior and then inform yourself about it and then convince yourself that it is worthwhile. So this comes through the information, education, and communication programs. So the other aspect comes from your BCCG. It means the program change in communication. So as I mentioned, COMBI is one of the approaches. It is really an advanced stage of the social behavioral change communication. So here the community decide to do something about it, and the community should act on this particular decision. When you take a decision and you know that there is a need, and then demand has to be created, and when you decide that we need to do something, then of course we have to and we have to act on this particular decision and reconfirm that your action has had positive. That's very important. So we have to look at the benefit and the outcome also. Then maintain the behavior, because it's not like do something and then don't think that it will be over. So it has to be sustained. And this is kind of, the BCG, the social behavioral communication aims at achieving this. So this is very important to achieve this. Then coming to community participation. So we need to know that what is community participation. So before that, we need to know what is community. Community, of course, we know is a group of individuals. And these individuals means that they are living in the same geographical area, because there is certain criteria which you have to follow, define a community. So like fisherman community, you say, because that is related to that profession, something like that. So tribal community, again, it is the ethnic group, and also they have certain cultural aspects. Like, so the community has certain definitions, certain indicators. So it means that one, they may live in the same geographical area, share common goals and problems, have similar interest or social network or relationship at the local level, have common system of communication, then share some resources. Like for example, in a village, they share water, they just go to the same school to educate the children, and also they use the same the healthcare facilities for any health issues. Then they are the sociologically and psychologically linked, because always there is a binding psychologically, relatives and friends and things like. And sociologically, it means there is bound to follow certain the norms. Then coming to community participation, of course, the process by which the community mobilizes its resources, it means that simple participate in the program to achieve the desired goal of the health system. So it means mobilizes, they can mobilize certain resources, initiates and then takes responsibilities for its own developmental activities, and share its decision making for and implementation of all other developmental programs for overall improvement of the health status of this particular community. The key to the successful organization of the primary health care system is that community participation is very important, and primary healthcare system is successful because of the active community participation. For example, the PSC, you have the healthcare facility. It is a healthcare facility is available for group of villages. So the people go and then they avail the healthcare in different this. So it is basically it is a community participation. The PSC system is a success story of community participation. And the other thing is that the aims of community participation, of course, the community should develop a self-reliance, both in terms of the technical, in the sense, for example, to manage a particular situation, that what is a technical this thing they should have. They can invite experts, they can get the opinion, and all the resources that we need people, we need money. So that is very important. Self-reliance is one important, and the community should be able to develop that. And then critical awareness is very important. It's a kind of a signaling of a particular situation. That's very important. And then problem solving skill is very important. When they have the problem, then of course they should be able to solve the problem. It means they can have the dialogue among themselves, or they can invite the experts from outside, and they can get the remedies or the methods or the solution for the problem. So the types of community participation, of course, passive, active, and involvement. And passive is nothing but what health system says they'll follow. it's merely they are the spectators. So, like for example, if the health system says you clean your environment, they'll do it. That's all. But active is something different. Active is consultative. It means carry out certain tasks in the program, including decision making. It means they analyze the situation, they identify the solution, and they do it. So that is active community participation. Then the third thing is the involvement. So involvement is much more than active. It means there is a community control for the entire activity. So this is the difference between community participation and community involvement. It means community participate in all aspects of the program. So, and it enables the community to participate willingly to improve their own health status. Of course, this can be done by thinking, planning, and acting and evaluating. And community participation involvement empowers or enables the community to overcome the health effects. But involvement is something beyond that. It means they also participate in planning, implementation, management, and evaluation of the program. Then inculcate the feeling of responsibility. It is not like the responsibility of the health system, it is a responsibility of the community. So they can really utilize the health system services to make a better, the outcome of the participation. Then accountability is very important. They do something that there should be some kind of accountability what they are doing. Like then, of course, they develop self-reliance and social control over its own infrastructure. This is the difference between participation and the involvement. And of course, we have a different process. A top-down approach. Top-down approach is that, for example, NVBD, CP, whatever they say, that it's being followed. It means at the top level, what the decisions they are making, it's simply they are carrying out at the community level. So it means it's more of a need based. But bottom up approach is that it starts from the community. The community identify the problem and make certain decisions, and they utilizes the health system and other systems to have a better health. Then it has the three dimensions. It's involvement of all those who are affected in decision making. It means that the deceased individuals are those who are at risk, and what should be done and how it should be done. And then mass contribution to the development efforts, that's to implement of the decision and sharing the benefits of the program. So these all the three dimensions of the community participation. And then factors that promote community participation are they should know that what is the relevance of a particular activity and also own their accountability. Then education status of the community, definitely yes, because when you talk about the media for communication, then the education status is important. Then how we can reach the community. Like then community infrastructure and also the communication networks is important. That will definitely influence. For example, now we know that now internet facilities are available everywhere in the villages, but earlier it was not like that. So it was available only in the urban areas. Similarly, the tvs in fact had come to the villages. Started from the urban areas. Like then of course economic factors, like for example use of the personal protection measures, income generating programs. These are the important things which really facilitates the community participation. Social and cultural factors, if they have certain cultural factors, so you have to design your strategies according to that. The level of intersectoral collaboration, then suppression of the involvement and the initiative by projects that create dependency, and then the political stability, and then motivated community, then a sense of ownership, and locally available resources. These are all the factors which really influences on that. Then situation analysis, of course, we can do it jointly. They can just look at what are the routine schedules, and then seasonal calendars when the risk increase a particular season. So what activities they have to have. Then trains and direct observation, transit walk along the area, and then identify the problem. And then of course Venn diagrams, it means that we can have the breeding source. So for example, here is an example. So we have the clean water habitats and you have polluted water habitats. Certain species breed in both the areas. So this area is important overlapping area, so we can consider. So people should be able to understand that. Then key for informant interviews to identify all the barriers and things like, and focus group discussion to understand the community feeling like. And then types of the communities, of course, we can utilize the self-help groups, and then the pressure groups. It's self-appointed citizen like community leaders and village heads, and the traditional organizations, non-profit organizations, and welfare groups. So these are the different communities, and we can make utilize of this. So this is the last slide. This is example of community participation. Quickly, I'll just show that. The community vector control in Indonesia, it was a successful program. Of course, they had a combi and then make the community to prevent the mosquito breeding. So make their domestic, peri-domestic areas free from breeding. That was a success story where community participated, because you cannot spray an insecticide and your health system will not have the sufficient infrastructure to control that. Then participation in the control of Brugen filarias, which we have demonstrated, because this particular the filarias is that which the Brucia malai. The vector is the Mansonia mosquito. So the Mansonia mosquito is closely associated with the water weeds. So without water weeds, that the mosquitoes cannot breed. If there is no mosquito, then of course no transmission. So very simple. So, but how to remove this, get rid of these weeds. And of course, it was demonstrated as a fish culture in the ponds, because the ponds are used by the community, so we cannot ask them to close. So this innovative method, it means that demonstrated the fast growing edible fishes in these ponds, because the ponds are suitable for growing these fishes, and this was demonstrated. So people came forward. Only thing is, the other sectors facilitate, like fisheries department, they provided some kind of incentive, they provided all the the fingerlings. So this was a successful story by which an income generating program can motivate the community to get into the program and then make the area free from mosquito breeding. Then control of malaria in coastal villages, because in one of the coastal villages, the malaria was endemic. The cases were occurring, and mainly this is because of the vectors that breeds in the backwater. And the backwater, it's a vast area of water collection, so we cannot control. You cannot use insecticide, and because the fishes will be there and things like, so it will be very difficult. So what it was done, so it was demonstrated that the algae, so in fact the entire water body, so you have full of algae. This algae, technology was developed. This algae can be utilized to make the paper. It's a handmade paper, and there are number of handmade paper industries. They came forward and they collected this. So this was sold for money, and then the people during the leisure times, they collected these weeds and they sold it. So once the weeds are removed, the mosquitoes, the breeding will be prevented, because normally what happens is it forms a kind of mat on the surface of the water. These mosquitoes lay their eggs on the algae. So this algae really a barrier between the larvae and the larvivorous fishes. So once it is removed, they are exposed to the larvivorous fishes, and they just feed on it. So this was demonstrated, and the malaria was controlled in this area. So this is one of the important aspect of community participation, success story of community participation through income generating program. And then construction of the check dams. That the mosquitoes, particularly the fluviatilis, and they breed in slow moving streams and rivers. So in Orissa, of course, you can see a number of such dreams, and the villages located near that places, they are affected by malaria, so mainly because of the vector breeding. So we demonstrated that construction of the check dams and periodical flushing of the water, so it really removes or carries all the larvae down, so that that the mosquito production will be reduced. So this was constructed by the the partnership approach, and then the people, the community, that they take once in a week, they used to the release the water, so that intermittent flushing resulted in the vector control. Then and finally, rubber plantation area. Of course, this is a preventive measure, because this is rubber plantation, small farmers to large, the entrepreneurs were there, and they just collect the latex by using the latex collecting cups. But these cups are left as such during the rainy season, and that was major source of vector breeding, Aedes albopictus, and responsible for dengue and chikungunya. So through community participation, then this was demonstrated that they can leave the water cups water cups without water, and we can. So this through the community preventive measures were demonstrated. So these are some of the success stories of community participation. So thank you.